Greetings. I am Tanisha Thomas, a junior healthcare management student from St. Thomas, United States Virgin Islands. And today I will be talking about what happened to Dr. Ives. Dr. Ives was working in a laboratory, and Mr. Drummond, who was a comatose patient, posed as Dr. Schaefer and hit him in the head with a sandbag. Mr. Drummond gave Dr. Ives a major shot of digoxin, which produces cardiac arrhythmia. This left Dr. Ives with an hour to live. But Dr. Drummond took Dr. Ives to the emergency room with chest pain. Because Dr. Ives was an employee, he skipped all the preliminaries and check-ins. His vitals were taken and he had a ventricular contraction of the heart. He was given an EKG. Instead of taking care of the patient right then, as a triage situation or in a trauma situation, they pushed Dr. Ives to the side where he was left to die. It wasn't until Miss Christie, the accountant, went to get health insurance info, they realized that Dr. Ives had passed away. Due to the lack of professionalism and not following proper protocol, Dr. Ives was not seen in the proper timing for a triage situation such as this.
Greetings, I am Dorothea Rodell, a junior healthcare management student from Miami, Florida, and I am here to discuss with you the 5 whys. Why is the patient check-in system so unorganized? Why do they not have a proper check-in system for admitting patients? Why did Dr. Ives only have an EKG done and then pushed to the side, left to die? Why was the hospital staff unable to identify patients to be seen? And why were employees poorly trained in all areas?
Greetings, my name is Taisha Brown. I am a junior healthcare management student from Vero Beach, Florida, and today I'll be talking about the fishbone diagram. The environment was in the emergency room. The people were Dr. Ives, Dr. Spezio, Miss Christie, and Mr. Drummond. The procedure was the doctors did not treat him as a triage or trauma patient. The equipment was the machine to check the vitals. The effect was the death of Dr. Ives. The material was the digoxin sandbag.
Greetings and humble salutations. I am Talicia Isaac, a senior healthcare management student from Miami, Florida. And the root cause was that staff not trained properly and have not received continuous education, which led to verification is null and void, that did not do any preliminaries because they knew who Dr. Ives was. They started working on him and then left him to die. He should have never been pushed to the side. The casual factors include employees not knowing each other. They were very understaffed. For security purposes, Mr. Drummond should have never been able to just walk into the laboratory in the first place. There should have been some kind of security to get into the lab. And this led to Dr. Ives' death.
Greetings. I am Shanice Cook, a senior healthcare management student from Clewiston, Florida. And today I'm here to discuss the risk reduction and strategies that the hospital can use to prevent any errors. First thing they should do is to eliminate the chance of failure. So a strategy they can use is to change the process to prevent failures. The second one is to help employees to perform their jobs correctly and diligently. A strategy they can use is to conduct precautions inspections using checklists for other reminders. Second one is to educate staff and monitor compliance. The third risk reduction strategy they can use is to help employees identify and correct mistakes before patients are harmed. They should do that by training people to better recognize and deal with unusual situations and create specialized teams to deal with unusual situations.
Greetings. I am Tanisha Thomas, a third year. Is it not third year? Shit.
Junior management student from Clewiston, Florida. And today I'm here
To discuss with you the 5 whys. Why is the accounting slash, check I said slash, oh my god.
Today I'm here to discuss about the risk reduction. Try it again.
Greetings. I am Tanisha Thomas, a junior healthcare management